Hello and welcome to Diplomatic Passport on Zim Papers Television Network, a program where we give you daily updates on the COVID-19 stats, Zimbabwe's preparedness and response effort. We also take a look at regional and global trends. My name is Blessing Munatsi. We start by giving you figures released by the Ministry of Health and Childcare. Zimbabwe recorded 31 deaths and 405 new cases of COVID-19 yesterday. And this brings the total number of active cases to 21,809. The cumulative number of cases now stands at 117,258. And of these, 91,499 are recoveries, while 3,950 resulted in deaths. Harare still tops the number of new infections recorded, 55 new cases of COVID-19 yesterday, followed by Mashonaland Central, which had 11 new cases. Now, coming from the long heroes break, 145 deaths were reported from Saturday through to Tuesday, while new cases stood at 1,013 in the past 4 days. Zimbabwe currently has 498 hospitalized cases of COVID-19. Of these, 34 are new admissions, 76 are asymptomatic, 326 are mild to moderate cases, and 76 of those admitted have severe symptoms, while 20 are in the intensive care unit. Zimbabwe's vaccination program continues. As of the latest data, 15,178 people received their first dose by the end of the day, bringing the cumulative for the first dose to 1,912,592, while 16,783 received their second dose, to bring the cumulative for the second dose to 1,061,238. Now, Zimbabwe is running a mass vaccination campaign as it aims to vaccinate 10 million people by year end in order to achieve herd immunity. Just over 1 million people have been fully vaccinated, according to these figures. During a recent presser where he announced the extension of level 4 lockdown by a further 2 weeks, Zimbabwe's President Emmerson Mnangagwa said he was happy with the country's progress in terms of vaccination, but urged the nation not to be complacent, as we still have a long way to go.
Our vaccination program continues to gather pace. So far, more than 1.8 million citizens have received their first dose, while over 1 million have fully been vaccinated. We thus continue to lead most African countries on our continent. While these are great milestones, our country, however, still has a long way to go to reach over 60% of the population for herd immunity. Several countries globally and in our region are beginning to experience fourth pandemic waves. Quite worrisome to us are trends in countries that are next to us. In most all of our neighbors, infections have shown an upward trend. We therefore need to remain vigilant now and not later, if we are to effectively control the current third wave and avoid a fourth wave.
The progression of COVID-19 symptoms varies over populations and also depends on other factors, including underlying conditions as well as age. While in the initial stages of COVID-19 emergence back in 2020, positive cases in children were far and in between, with some even speculating that children were immune to infection. We have since learned otherwise, even though the younger populations do tend to fight it off better. Well, in recent times, especially with the emergence of new COVID-19 mutants, like the Delta variant, we have seen an increase in the number of children getting infected by COVID-19. We did catch up with the Chief Coordinator of the National Response to the COVID-19 in Zimbabwe, Dr. Agnes Mahomva, who indicated that this trend is not peculiar to Zimbabwe.
Indeed, we have seen a number of children getting infected. That is not as we always knew they probably did get it. They were just not as affected as adults. And it might also have to do with the widespread testing that we're doing now. But then we compare ourselves globally. Many countries are also seeing this trend, basically. So it's not too surprising in terms of how widespread it is. As things unfold, quite clearly we have to gather data from all our provinces and analyze. So when we have detailed analysis, we'll quite clearly share it without any problems at all.
In many countries, discussions and research continues on the development of vaccines and also if there is a need to vaccinate children and adolescents against COVID-19. Research is currently underway to determine the risk factors for COVID-19 vaccination and in children in particular. And Dr. Mahomva gives us a picture of the current scenario.
In terms of the studies being conducted, in terms of what now? Which studies do you want? Sorry. Into vaccination of children, you are aware that when the manufacturers of vaccines finalize their manufacturing, they do what they call clinical trials and so on, and they look at various groups of people in their clinical trials. They include whether it's females, males, the pregnant women, and then they analyze the data and they're able to confidently, scientifically say, this group, go ahead and vaccinate and so on. When they issued their vaccines at the very start, they had not vaccinated a number of children, and hence there was no data to analyze to tell us what's happening with the children. They are doing that now. So quite clearly, we're also eagerly waiting for those results that can guide us. There are one or two preliminary findings here and there which are guiding certain nations, but we like to have a comprehensive understanding of what's really happening. We are not too keen to simply dive into something because social media says.
Angela Simao, WHO Assistant Director General for Access to Medicines, Vaccines and Pharmaceuticals, said that we should leave everything to science, also noting that children are not part of the priority group in terms of vaccination.
Why aren't the vaccines, when you started, why wasn't children, or adolescents first target? Because when you have new products, you don't test in children, right? Which is an ethical thing. And you don't test in adolescents and you don't test in pregnant women. So with time, we got some evidence regarding safety in pregnant women, and several countries WHO started recommending in certain contexts, and now we have some studies showing the safety in adolescents, but the WHO is still, the expert group is working on this, but we don't have yet the information, the necessary scientific information about safety in children. But we do know that children it's very rare to develop severe disease, right? So again, we go back to the priority, right? First we have, because then in children, it's the two things, right? The safety and the fact that you need to take into account whether, the children have a high-risk situation or not, right? Because they don't develop severe disease.
So there you have it. The COVID-19 challenge is a new challenge, and ongoing research and development continues as we seek to find a solution, a lasting solution to this pandemic. Diplomatic Passport comes to a close for today. Thank you so much for making us your choice. Do remember to play your part. Do get vaccinated. Sanitize your hands frequently. Social distancing and masking up is critical. Diplomatic Passport signing out for today. Thank you so much. We're back again tomorrow. Do join us then. Goodbye.